Hi, I'm Dawn Marie Ickes, and I'm coming to you today on behalf of Balanced Body. I am a physical therapist, and I am the co-owner of a physical therapy clinic in Southern California called Core Conditioning. We specialize in integrating Pilates, gyrotonic, and other movement therapies into the rehab setting, as well as an integrated approach to fitness. So today we're going to be looking at an exercise that is particularly effective with the pregnant population. One of the things that we see typically in pregnant women, especially as they get to their second and third trimester, is a loss of trunk rotation as their belly is progressing. And this is an exercise that's going to get a little bit more thoracic rotation, hopefully alleviate some of the thoracic mobility problems which come from an increase in breast size and a change in the kyphotic curve in the thoracic spine. So what I'm going to have you do is go ahead and sit all the way up to the front of the carriage with your feet on the platform to start. And we're going to use a physio ball to support her back. One of the things we want to look for is not creating too much strain in the pregnant torso, and the physio ball just gives a nice little bit of support and input. And now I'm actually going to help you push the carriage out a little bit and bring your feet up to the foot bar in Pilates stance. Excellent. And then I'm going to have you slowly bring the carriage back in as far as your legs will allow, and reach your arms up at a diagonal to start. So what we want to look for with the pregnant client is there may be some hip flexor tightness or some hip capsule restrictions that will make it difficult to get the carriage in very far. So you really only want to push the client to the limit of what they're comfortable with. So what she's going to do is she's going to blow all the air out as she lengthens out of the top of her head. And then as she inhales, she's going to slowly extend the legs and reach the arm out, just as if she was doing regular stomach massage. And I'm going to give her a nice gentle stretch. And then she's going to exhale and grow taller as she slowly brings the carriage in and back to the start position. Go ahead and do two more of those. We're going to do the same side for demonstration purposes, but obviously you would switch to the other side. Good. And one more. And what I'm also looking for is I don't want her to hyperextend her back or flare her ribs. I want her to keep her ribs nice and connected, and I want to just give her a nice pectoral stretch here. But I'm also looking at what's happening at her feet, making sure that they're not swiveling. And go ahead and slowly come on in. Good. And what I'm going to have you do is go ahead and place one foot on the platform, and then I'm going to take the ball out, and then you can slowly scoot back. And just relax for a minute there. Good. And so this exercise that we looked at today is really looking at trying to improve thoracic mobility, a little bit of rotation, because those are the things that commonly start to become diminished in the third trimester of pregnancy. We can also look at pelvic stability, making sure that there's not too much movement of the hips as the thoracic spine is rotating. Thank you very much for joining us today and learning this new exercise, and we look forward to coming back to you soon.